Hey everybody, how are you doing? It's just Anthony McMahon with Claim Links. Just wanted to put together a quick 2 to 3 minute video for you here, walking you through the best way to finance and purchase health insurance for your company and your staff members heading into 2024, and why, in my opinion, it always makes sense to leverage primary insurance carriers for their provider networks and protection against catastrophic claims, while underneath of that, utilizing a medical expense reimbursement plan to give your people better benefits at a fraction of the cost. So diving into it, I'm just going to illustrate here with some pure mathematical numbers. I'm going to compare a gold plan with Anthem Blue Cross Blue Shield with a bronze plan with the same exact carrier in my state of Pennsylvania. And I will break down what those numbers look like and why it always makes sense for especially small businesses to purchase health insurance in this way. So if you compare these two different plans, as mentioned, they have the same exact provider and hospital network. It's the same type of plan that you would have in place with either. And let me blow this up a little bit so you can see the whole screen. So if we're comparing the deductible versus deductible, there is a $7,100 difference, a $2,000 deductible in this gold plan, a $9,100 deductible in this bronze plan. And then if you look at the out-of-pocket maximum, $8,700 on the gold plan, $9,100 on the bronze plan. But when you actually go to the monthly premium to have these plans in place, you can see that the numbers are drastically different. So for the monthly premium for the gold plan, it looks like it's about $2,300 per month, as opposed to this bronze plan where it's $1,200 a month. Over the course of the year, for this plan, you would actually have to pay $27,500 to have that plan in place. While if you had this bronze plan in place, you would only be paying $14,500. Now, comparing these two different plans, you can see here that the additional risk assumed, if you're comparing out-of-pocket max versus out-of-pocket max, is only $400. Even if you compare deductible to deductible, it's $7,100. But when you compare the annual premium versus the annual premium, you're saving over $13,000. You have the same exact carrier, Anthem Blue Cross Blue Shield, same exact provider and hospital network. It's the same type of plan. This is an HMO. But you can see here that if you purchase this primary coverage for your people, as opposed to getting, a typical gold, silver, platinum plan through traditional group insurance, you're guaranteed to save every single time. So you can see right here, you're saving over $13,000 in premium, and at most, you're assuming $7,100 of risk, if we're comparing deductible versus deductible. Now, what you want to do is, because obviously you don't want to give your people a $9,100 deductible, they probably would not be happy with that. Underneath of that, that's where you implement what's called a medical expense reimbursement plan. And this is what it looks like. Simply put, it gives you the ability as an employer to provide your people with better benefits underneath of their primary coverage. You could list out exactly what you want the deductibles and copays to be. So for instance, if you wanted to give your people a $1,000 single deductible, a $2,000 family deductible, you're in your full authority to actually do that and spell out exactly what these benefits are going to be underneath of your primary coverage. And what most of our clients do is they just mirror the exact same coverage that their people were accustomed to prior within this plan, and then have this primary insurance with a high deductible plan sit on top of that so that they can see all the same providers, they have the same type of plan in place, and there's no disruption of benefits. But the result of having these two in tandem is results like this. And I'll show you a group right here. They have about 120 in total on their company healthcare plan. You could see that in 2021, they paid over $1.5 million in total for their company plan. After implementing that simple two-step process, moving everybody over to a high deductible bronze plan and putting a medical expense reimbursement plan underneath, what you can then find is the next year they saved over $800,000 and cut healthcare costs by 52%. Secondarily, here's a smaller group that we've been working with since that same time frame. You could see that in 2021, they paid $98,000 for their company healthcare plan. After implementing that same process, they stayed with their same carrier, just moved everybody over to higher deductible plans and put a MERP underneath of that. They cut healthcare costs by over $70,000 and reduced that cost by over 71% in 2022. And here's just a further savings report here. This is our top savers of August 2023. We broke them down by sizes, so less than 10 members, 11 to 25 members, and more than 25 members. You can see here that the numbers are drastic. For groups literally, 5, 9, and 8 in size, they're saving anywhere between $600 to $8,500 per month, and cutting costs by 65% plus. So these numbers are pretty drastic. I would say our average is about 40% for most of our clients are saving in net savings after fees, claims, everything in between. But overall, just wanted to illustrate the framework here of why you always want to purchase high deductible plans with your provider or with your preferred carrier, and making sure that it's the same provider network, same type of plan, everything like that. but underneath of that, provide your people with better benefits at a fraction of the cost, not only to them and their families, but also to you and your business. And this just keeps you in a really good driver's seat and make sure your healthcare plan is sustainable over time. And this isn't even including things like subsidies, grants, coupons, everything in between. This is just an overall initial structure that is, pretty much guaranteed to save your company money and improve the benefits that your employees experience day to day. So hope this video was helpful. If you have any questions, feel free to reach out to me. My email is amcmahon@claimlinks.com. Thanks so much.